It's 8 o'clock. It is the beginning of a new week. It is Monday today. I have about 7 days left in my hospice and palliative care fellowship, which is surreal because I feel like I still started. I just barely started this fellowship. And here now I'm looking at it, we have about 7 days until it's all over. So the big goal for me today is to completely take advantage of these last couple of days of this fellowship, because after this fellowship is done, I'm done with training. I'm no longer a trainee. I'm going to be starting a new attending job that I secured back in March, and the new job is going to be starting September 1st. So I really want to take in as much as I can from my mentors and my attendings that are currently working with me right now, and just to see what can I do to kind of help facilitate this process. And I think also the big thing that I want to do today is to make sure that I finish everything by 6 p.m. I try to be as productive as possible, mostly in the mornings, because that's when I do my Bible study, that's when I do my Anki cards, and that's when I do my workouts. And then I'm trying to do 25 questions a day for my studying habits for my board exam. So I'm really trying to stay as efficient as possible, so hopefully I can finish everything by that time in the day.
You say you need your space, then pull me close. I read your silence, louder than most. One day you're warm, the next day you're cold. Got me second guessing what I already know. I give you love, but you ration yours. You open up just to close the door. I stay up late, trying to read your mind. I can't read your mind, but your love got rules that change all the time. Why are you always halfway in? Got me drowning when I know I could swim. If you love me, baby, say it with your chest. Yeah, tired of the maybes, I just want the yes. Don't play me like a song on a spin. If you ride for me, then ride to the end. Don't wanna love this paper thin. So why you always halfway in? You hit me up when the nights get slow, but then disappear when the highs get low. I ain't your maybe, tell me what it is, 'cause I'm way too grown to be messing with a love like this. I give you love, but you ration yours. You open up just to close the door. You stay closing doors. I stay up late, trying to read your mind. I can't read your mind, but your love for rules that change all the time. Changing all the time. Why are you always halfway in? Got me drowning when I know I could swim. If you love me, baby, say it with your chest. Yeah, tired of the maybes, I just want the yes. Don't play me like a song on the spin. If you ride for me, then ride to the end. Don't wanna love this paper thin. So why you always halfway in? Why you always halfway in? Got me drowning when I know I could swim. If you love me, baby, say it with your chest.
We finally headed in. I'm feeling pretty good this morning. Honestly, I think one of the biggest things that I am looking forward to when I finish this fellowship program is just to finally be done with training, because when you're in training, I don't know, it's like you always have this veil of like the end. And now that I'm finally going to hit the end, I'm like, wow, like these is what all of those years of training has come to. I spent 4 years in college, 4 years in med school, 3 years in residency, a year of chief year, and then now a year of fellowship that I'm finishing. That's 13 years. And when you think about it in that way, it's like, wow, like over a decade, I've been doing all of this training. And to finally be done, I'm going to be honest, I am a little bit nervous about finally being in that position of leadership, position of, all right, like you're in charge of this clinic, you're in charge of this service, you're in charge of all of this. So it's a lot. So I know one of the hardest transitions for me, at least when I was going through this entire training process, was probably, I wouldn't say, I'll tier them. So I think the hardest years was actually my transition from my first year to my second year of residency, mostly because of the workload increase and the responsibility factor. And then the second hardest year in my medical training was probably going from college into med school, just because, whew, man, the amount of information that I had to adjust to learning at that pace, it was a lot. It was a lot. So I'm really happy to finally be at the end of this process and seeing all these new interns coming in and starting a whole new entire journey like I did over 5 years ago. It's really nice to see. So I'm really happy this morning. I'm feeling good. My morning workout went really well. I've been doing calisthenics for about 10 weeks now. I've been wanting to switch over to calisthenics because I've been doing, regular weightlifting with dumbbells, weights and all that for about like 5 years now. And I felt like I was kind of plateauing and I wanted to switch it up. I try to switch things up every so often so I don't get, kind of stuck in a monotonous process. And since switching over to calisthenics, it's been hard. It's definitely been hard, but it's been pretty fun because I can feel I can just do this workout anywhere that I go to, not having to rely on any sort of weight and just relying on my own body weight. It's nice to know that I don't have to rely on all of that. So I have about 2 to 3 more weeks. I usually do my workout routines in like 13-week increments. And hopefully after that, we'll see what we'll switch over to. I think there's a couple of things in my workout routine that I do want to change. I do it in that length of time so I can actually change things up. So I'm really happy that I've committed to it this long and I'm looking forward to trying it. But let me know what you guys think. Is there any sort of like workout routine that you try to do specifically? And what is like your process in terms of like managing your own health? I'd love to hear you guys in the comment section down below. I'm going to be in the clinic and in the inpatient setting. Usually at the VA, I split my days on Mondays because Mondays and Wednesdays is when we usually have clinics. Wednesday was just added on this year because we're trying to catch up to a lot of patients that we're not able to see because there's only one attending on our service. However, I am looking forward to the clinic because I recently switched buildings with my team like a couple of months ago. And when we switched over, we already finished our clinics for that week. So I wasn't able to actually do the clinic in the new building. The new building is nice. However, I'm a little like icked out because since coming back, I guess they're having some sort of like bug issue because every time I come in the morning on this rotation, there's a bunch of bugs, dead bugs all over the tables and like everybody's annoyed, everyone's disgusted. So we reached out to like the management for the building and hopefully they can fix that because I'm not trying to come in and have to be fighting bugs every single morning to work there because that's just unsanitary. But in the morning, I'm going to see some old patients that are on the inpatient setting. And then on the afternoon setting time, usually we start our clinic around 1 p.m. It's divided into phone appointments, in-person appointments, and video visits. We usually like doing the phone appointments and the video visits because our cancer patients in that clinic, we don't really like for them to come to the hospital all the time because they're so fatigued and they're feeling so many symptoms. So unless they're having some other appointment there already, and if they also like recommend or ask to do things in person, then we usually try to schedule them through the phone or through video visits. That way we don't lug them all over to the hospital for like a 20 to 30 minute thing. So I think that's just something that we try to do that I found very beneficial and something that I want to do for my clinic in the future. But I try to do things in a way that's patient-centered, because they go through so many appointments already. We don't want to lug them all the way over here for something that we don't have to do in person. It is beneficial to see them every so often in person, just so we can kind of physically see the changes. But if not, we try to do those video visits. So hopefully our clinic today goes well. I do have a geriatrics fellow that's also following along with me, so it's nice that we'll be able to split up the clinic in the afternoon and kind of just divide and conquer. It's nice to have someone that's from the geriatrics team, because we kind of have a nice little overlap with palliative care. So I am looking forward to working with her this evening and then getting up out of there so I can do some studying for my board exam.
From the first moment I saw you, I knew I had to make you mine. Wanted to know everything about you. I didn't want to waste no time. What's something I can do for you, darling, that would make you smile? I'll bring you flowers, girl, enough to see for miles. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. I love your style, and I love your grace. Said I love to put a smile on your pretty little face. I love it when you're close to me. That's where I want you to always be. I didn't know when I found you that I would find a love so true. And you can see it in my eyes. That girl, you've got me hypnotized. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow.
It is blazing hot right now. I saw one of my team members use an umbrella to block themselves from the sun. I'm trying to stay out of the sun because I was just in Cancun a few weeks ago, and I think I got enough exposure to the sun for a lifetime. But we finished up our morning block. I saw 3 patients, one of which was from last week, actually 2 of which was from last week, and one of them was a new consultation, and it was a good consult. It's gonna be one of those ones where I can repair the relationship and the perception of what families think about palliative care and hospice. So I'm gonna be working with that patient and their family throughout the week. Other than that, I'm a little frustrated because one of the consultations, they didn't actually follow all the recommendations that I recommended last week before the long weekend. And unfortunately, that patient is the one that felt the brunt of that. So nothing bad happened. They're still a little uncomfortable, so we're just gonna be starting a buprenorphine patch today, and hopefully their pain gets better. But despite all that, I'm headed to get some lunch right now. I will be doing my clinic in the afternoon. I have 2 patients that I'm going to be seeing, and then the other patient I'm having the geriatrics fellow follow. I'm excited though because I have a internal medicine resident that's going to be joining me for my clinic, so I'm going to be able to practice a little bit of my teaching chops, because that's what I'm going to be doing with my attending job starting in a few months on September 1st. I'm going to be working with residencies, so looking forward to it. I hope it goes well, and let's get this food in because I'm starving. I really want to get something in. This weekend, I actually did a night shift at my other job. I have 2 jobs right now. I have this hospice and palliative care job as well as my internal medicine job. The internal medicine job is more so per diem and just kind of picking up shifts as I go. Thankfully, when I was negotiating for this new contract for my full-time job, they were okay with me keeping a per diem job outside of their network. However, they did put a cap on how much I can make externally. So I think they capped it at like 40K or something like that. So I really want to maintain both my internal medicine and my hospice and palliative care licensing. And the reason why is that I feel like they kind of feed into each other. And I spent so much time going to residency for internal medicine, like 3 years as well as a chief year. So it'd be weird for me to like try to just drop it now that I have my hospice and palliative care fellowship underway. So I'm feeling pretty good. I'm happy right now. I'm feeling pretty good. I feel that a lot of things are coming into line for me, not only like professionally, but also personally. I do have some things that I do want to show you guys in the future, but as of right now, I think the biggest things that I'm super excited for is my graduation on Friday this week, as well as meeting the new fellows that are going to be coming on Wednesday. We're going to do like a dinner and all meet together and talk about how the fellowship is and things to kind of look out for. And then only 2 days left next week. So things are moving. I just got an email from my apartment complex today about the moving process. I am moving into a bigger unit because I do want an office and I want to have a lot more space. And it's funny, when you actually go check out other apartment units that are bigger than yours, you come back to your own and it's like, wow, like how am I living in here? So the disease of more. But I'm really excited to be moving into a new unit. The move-in date they gave me, unfortunately, is a day before I have to go leave for a night shift. So it's going to be a little bit of a tight squeeze to not only move things into the new apartment, but also clean the new apartment before I do all the moving. So I'm going to have to do a little bit of strategizing on how I'm going to do all of that. Time. Unfortunately, clinic is a flop today. We had 3 people we were supposed to see. One of them unfortunately passed away. The other one entered into hospice, and the other one's not answering the phone call. So unfortunately, that's a wrap. So I think I'm just going to go check on some other patients on the inpatient side. I do have a resident with me right now, so we're going to do a little bit of teaching later on if she does have some time. But if not, we're going to have to wrap the day up pretty soon so I can get home and do the rest of my to-dos.
Smooth as a silky pillowcase, slither in my innocent oasis. You bring the pain, I deliver patience. I see the lion and try to tame him. I know the werewolf behind the sheep, familiar the scent of deceit behind your pretty teeth. Say you need space to breathe, but what does that really mean? I don't believe when you said to me you really need space to breathe, but you really got up your sleeve. I don't believe when you said to me you really need space to breathe. I know something's up your silky little sleeve. Your silky little sleeve. Something's up your silky little sleeve. Silky little sleeve. I seen it coming from up the block. Must be the one that you think I'm not. Let me remind you if you forgot. I'm not the one or the two or the three or the five. Yeah, you in space, go back at your life. While you're searching, hope you find. Act right, saying you're fine. Read between lines. I was born at night, not last night. I can't believe when you said to me you really need space to breathe, but you really got up your sleeve. I don't believe when you said to me you really need space to breathe. Something's up your silky little sleeve. Your silky little sleeve. Something's up your silky little sleeve. Silky little sleeve. Lines between the lines, between the lines. Somehow I find you. I can't bother time no more. I'm tired. Lines between the lines, between the lines. Somehow I find you. I can't borrow time, I'm tired of trying. I can't believe when you said to me you really need space to breathe, but you really got up your sleeve. I don't believe when you said to me you really need space to breathe. I know something's up your silky little sleeve. Your silky little sleeve. Something's up your silky little sleeve. Silky little sleeve. What you got to hide? Behind that silky little sleeve. What you got to hide?
What can you say when love goes away that hasn't been said before? I have no rhyme that's different this time. There's no words to sing anymore. I haven't a clue why you went away. I only know you are gone. And I sit alone, my heart by the phone. And so I just listen to rain as it falls to the ground and washes the day away. nothing to show and no place to go. So here in my room I stay.
Yeah,
I
none of the
don't
patients showed
know
up.
that I could forget you.
Yeah.
No
Yeah,
matter
so,
how
like, well, one of them
hard
actually
I
died.
try.
I said they're
I'm
palliative
all
care, so I guess they were gonna
alone,
die.
and
eventually.
honestly, I don't know why.
And then the other one went on hospice. So yeah, I'm just finishing up cooking. My hands are a little full right now, so I have to keep you on speaker.
It's 8 o'clock. Let me see if I can get it in frame. I am finished with the day. I wasn't able to finish exactly when I wanted to end because things kind of got thrown off the mark for me because I had an appointment that was supposed to be at 5 p.m. after work today, but the provider actually canceled. So I decided to just kind of switch up and switch gears and actually do a little grocery shopping. I've been trying to do a little bit more ground beef cooking and eating. I've had it in like tacos and other meals, but I've never actually cooked it on my own. So last week was like the first time that I actually cooked it, and it tastes so good. Adding the oregano with the black pepper, with the paprika, with the cumin, with the pink salt, pink Himalayan salt, and I forget there's one more other thing. But regardless, it's really good. That with the sweet red potatoes in the air fryer for about 45 minutes at 375 with cinnamon, black pepper, and salt at the bottom. Ooh. Man, it's amazing. So I'm trying to do a little bit and be a little bit more conscientious about what I eat. Not that I don't eat crazy, not that I eat crazy or anything like that, but I'm trying to be a little bit more conscientious, even, down to a T. I'm not counting calories or anything like that because I feel like that's a little too tedious for me. And like, yes, I like to be tedious in certain aspects of my life, but with food, that's a no-go for me. But regardless, today was a really fulfilling day. I really enjoyed today. I had a resident with me, so I was able to do some teaching, and she was sharing with me her experience in the medical field. Everybody has such different paths in medicine, and it's just nice to kind of get everybody's perspective on what they've gone through to get to the point that they are now. So I am trying to learn more of people's stories. I've been doing that with my patients, but it's nice to kind of do that with other people as well. They're not directly my patients. So regardless of all that, I hope you guys enjoyed today's vlog. Check out the next vlog. I'm going to be making this a series for myself and try to keep myself accountable. And also let me know in the comment section down below, what are some things that you guys are trying to do to make a routine and keep yourself accountable as well? Because I want to follow along with your path so we can be a community here and keep on growing together and keeping each other on track. So I'll see you guys in the next one. Peace. Have a nice day.